Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to John Richardson. He works here with me at MCHD, and he's in a program called OD2A, which is Overdose Data to Action. John, how are you?
I'm great, James. Thanks for asking. How are you today?
I am good, except for a little bit of weather here catching me from outside, so I apologize if I stumble a little bit. But the reason why we're talking is that, and I had to write it down, it's kind of long, but October is National Substance Abuse Prevention Awareness Month. And it's a very important topic. I mean, here's some of the statistics on this, which is why we're speaking. 11.7% of Americans 12 and over use illegal drugs, and 53 million, or roughly 19.4% of people 12 and over have used illegal drugs or misused prescription drugs within the last year. Right. So those numbers are a little staggering to think that, 1 in 5 people, have abused something somehow.
Right. And those numbers are staggering indeed, James. Since 2011, Overdose National Prevention Month has been recognized by the CDC and SAMHSA, and they actually say that the period of time that you delay actual drug use up until age 21, the less likely you are to develop a substance use disorder problem.
Yeah, the statistics that I just gave, they start calculating at 12, which, right. I mean, gosh, you kind of talked a little bit about that, and you and I talked about that separately, that that's kind of the age of wonderment, discovery. Sure. So can you go into a little bit about why that year 12 age is such a kind of a benchmark?
Well, usually, just like you said, James, year 12 is usually the period of time when adolescents start to gain some semblance of independence away from their parents. They're able to be away from home for extended periods of time. They're exposed to new things, new adventures. Those are the exploratory years where, you have peer pressure, friends at school, the need to be acceptance, all those kind of things cause, adolescents to try drugs and alcohol.
Yeah, I think you just touched on some of the risk factors there. I mean, genetics and then peer pressure, obviously. So, there's a lot of stuff going on in that development stage of life for a young person. Sure. And, just like you said, if you can delay, or if a person can delay being exposed or, being around that environment, then they're less likely to become addicted to use, right. I mean, even cigarettes, that's an addiction.
Right. Even cigarettes, yes.
So, we have a program also for that too, SWAT yes. program, where we go and speak to, kids in schools. But getting back to OD2A, some of the other numbers that I have here, 139.8 million Americans 12 and over drink alcohol.
Yes. Alcoholism is one of the leading causes of addiction in our country, because it's one of the oldest forms of drugs, and it's legal. So it's readily more accessible. It's more socially acceptable. So there's more likely a chance you are to actually experience alcohol use than illicit drugs, so to speak.
Here's the other statistic. 58.8 million people use tobacco.
Yes.
31.9 million use illegal drugs. So when I was reading back through these numbers here, and have we even spoke about opioids yet?
Opioids are one of those drugs that we can't afford to overlook, especially at this time and day, this age and day, because of the number of pill mills that were found to be in our existence, which caused the opioid pandemic, which caused the CDC to develop this program that that I'm now in, the OD2A program, which goes out and devises strategies for opioid misuse, abuse, and deaths.
Now you've got some pretty good partnerships there in the community to help you and to help us combat this dilemma. You've got, partners such as the Mobile Police Department, the Mobile County Sheriff's Office. So any other resources that you've got partnerships with to help fight this?
Well, we partner with United Way of Southwest Alabama. We partnership with the Mental Health Association. We partner with the Peer Organization, which is a organization that's ran by Alabama Department of Mental Health. Also, we partner with the Alabama Department of Public Health, which oversees the OD2A program in Mobile County, Jefferson County, and Montgomery County.
Now, you and I put together a booklet there, like a resource booklet, to be able to help people find these resources. Hold that booklet up for a second. Let's show. Yeah, there is hope, and that's it's a little pocket booklet that you all have. So when you go to outreaches, you're able to get that booklet out in the hands of people. But it has a whole bunch of different resources there for treatment centers and recovery, and it talks about naloxone and some of the other things that we talked about, like opioids and such.
Right. It's a wealth of information in the booklet. It talks about finding MATs, Medicaid Assisted Treatment Centers. It talks about finding abstinence-based treatment centers, peer recovery resources within our community. It gives us information on how to recognize overdose, some of the signs of overdose, like loss of consciousness, unresponsiveness to outside stimulus, reducing harm, which is another therapy that's starting to gain wide notoriety in the treatment field. And it's where, if you can convince a guy to stop shooting heroin and just let him maybe smoke marijuana, then that's called harm reduction. So you kind of count it as progress. There was a day and time when that was not counted as progress.
Yeah. So it sounds like there's a lot of baby steps there.
A lot of baby steps.
Yes. One of the first places, I think, for people to start, if they're curious about seeking help, and I think they can give you a call. They can give you a call here at MCHD. So go ahead and give your number.
Well, our number is area code 251-410-6322, or OD2A. Area code 251-OD2A. That's 410-6233. 251-410-6233. That will give you the hotline to our program. And from that point, somebody will pick up the phone and direct your calls from that point.
Well, John, I appreciate you being on here to raise awareness for October for, Substance Abuse Prevention Awareness Month, and also for the OD2A program.
All right. Thank you for having me, James. We certainly appreciate all you do to help bring awareness to our programs, and for letting our staff, helping our staff become aware of these things through the use of dress down days with T-shirts like the one I got on now, which is for Overdose Prevention Month.
That's right. Yes, that is correct. Recovery. Yeah, that is correct. Yes, through us raising awareness as an agency, we have designated days like you just mentioned, John, where we all wear the same uniform, so to speak. So,
Right.
everybody that comes in our facilities will see, and then maybe they can ask questions or,
Sure.
what is OD2A, or, it just kind of gets you thinking. So, when we're all doing the same thing on the same day, it is highly, highly effective. So,
Yes.
John, thank you also too for, letting the agency be able to be a part of the awareness. So thank you again for being on Wellness Wednesday.
And thank you, James, for having us.